Hello everyone, my name is Olivia Arnaud. My presentation focuses on the impact of mandated safe nurse-to-patient staffing ratios on burnout rates and turnover among registered nurses working in United States acute care hospitals. This topic stems from both my research and my personal clinical experiences, and I will walk you through the background, evidence, and implications for practice. Background information. The nursing profession is currently facing a critical workforce crisis. Across the United States, nurses are reporting increased levels of burnout, emotional exhaustion, and job dissatisfaction. Many of these problems are linked to chronic understaffing in hospitals. As patient acuity increases and workloads grow heavier, nurses are expected to manage more patients than is safe, which can negatively impact both nurse well-being and patient outcomes. This topic is particularly important to me because I have seen firsthand how staffing shortages affect healthcare workers and patients. In my own experience, I have observed colleagues struggling to keep up with documentation, patient care tasks, and coordination of care, often sacrificing own breaks and well-being to meet patient needs. Over time, this level of strain can lead to burnout, which is a major contributor to nurse turnover. Identification of the clinical problem. The clinical problem I am addressing is the relationship between safe staffing levels and nurse burnout and turnover. Burnout in nursing is characterized by emotional exhaustion, depersonalization, and a decreased sense of personal accomplishment. When burnout is severe, nurses are more likely to leave the profession entirely, further exacerbating staffing shortages. Safe nurse-to-patient staffing ratios have been proposed as a way to protect both nurses and patients. These ratios ensure that nurses are not assigned more patients than they can safely care for. However, in most states, staffing ratios are not mandated by law, and hospitals may base staffing decisions on budgetary factors rather than patient acuity or nurse workload. My PCOT question is, in registered nurses working in United States acute care hospitals, how does implementing mandated safe nurse-to-patient staffing ratios compared with usual staffing levels affect burnout rates and turnover over the subsequent year? Here, the population is registered nurses in United States acute care hospitals. The intervention is the implementation of mandated safe staffing ratios. The comparison is usual staffing levels without mandated ratios. The outcomes are nurse burnout ratios and turnover within the next year. The time frame is 1 year. To gather evidence for this topic, I conducted a systemic literature search using databases such as CINALH, PubMed, NIH, and ProQuest Nursing and Allied Health. My keywords included nurse-to-patient ratios, safe staffing, burnout, turnover, and acute care. I limited my search to peer-reviewed articles published in the last 5 years to ensure the findings were relevant and up-to-date. I reviewed 5 primary research studies that met my inclusion criteria. All of these studies examined the relationship between staffing ratios and nurse outcomes, such as burnout and turnover, with some also addressing patient safety outcomes. Overall, the literature consistently demonstrated that lower nurse-to-patient ratios were associated with decreased burnout and turnover. Studies conducted in hospitals that implemented mandated ratios, such as in California, reported improvements in nurse satisfaction, reduced emotional exhaustion, and lower intent to leave rates compared with hospitals without such mandates. Several studies use cross-sectional surveys to collect data on nurse workloads, burnout levels, and turnover intentions, while others analyze hospital workforce data before and after policy changes. A common finding was that improved staffing not only benefited nurses, but also led to better patient outcomes, including reduced mortality rates and fewer adverse events. However, there were also differences in findings. For example, some studies showed significant cost savings from reduced turnover, while others highlighted increased hospital costs related to hiring more staff. Methodological differences also existed, with some studies relying on self-reported data and others using objective hospital metrics. Despite these differences, the majority of the literature supports the idea that safe staffing ratios are a key strategy in addressing burnout and turnover in acute care settings. Based on my review of the evidence, I can answer my PCOT question. Implementing mandated safe nurse-to-patient staffing ratios is associated with lower burnout rates and reduced turnover among registered nurses in United States acute care hospitals. While there are financial considerations for hospitals, the long-term benefits for workforce stability and patient safety appear to outweigh the costs. The studies reviewed suggest that safe staffing is not only a workforce issue, but also a patient safety imperative. By protecting nurses from excessive workloads, hospitals can promote nurse retention, which in turn supports consistent, high-quality patient care. The implications for practice are clear. Hospitals should advocate for and adopt safe nurse-to-patient staffing ratios, whether mandated by law or implemented internally. Nurse leaders can use this evidence to push for policy changes at the organizational and state level. Additionally, incorporating acuity-based staffing models alongside ratio mandates may further optimize workload distribution. Improving staffing is not a quick fix, but it is a necessary step to support the nursing workforce, reduce burnout, and ensure safety, effective care. By addressing staffing issues proactively, hospitals can improve nurse retention, patient outcomes, and overall organizational performance. This last slide shows a list of the references, studies provided for this project, and evidence base for this presentation. Thank you.